Hello everyone, good day. We'll talk about oral contraceptive pills. Now, oral contraceptive pills are pills you take in order to prevent pregnancy. It's actually very essential for a woman who has just given birth and want to space the children in order for her body to recover fully. Oral contraceptive pills actually is very good in the sense that it prevents pregnancy and also useful for premenstrual syndrome also. Now, oral contraceptive pills come in different forms, in two forms majorly. One is the 28 days pill, and the other one is 21 days pill. Now, 28 days pill is basically 21 days with the hormone, and then 7 days without the hormone. Now, it is within these 7 days that it is expected for a woman to see her menses. Now, we can divide the oral contraceptive pills week into 3 weeks. Week one is the first 7 pills. Week two, second 7 pills. Week three, the third pill. That's it. They come in two form. One, the tablet are just 21, and the other tablet are 28. Now, the one that tablet are 21, after I finish taking the pills for the 21 days, you give yourself 7 days break. That is the time it's expected for you to see your menses. For the 21 days, 28 days one, the remaining 7 days, the remaining 7 pills are actually used for you to keep track of when you're supposed to start when you're supposed to start the pills again. Now, the question is, when are you supposed to start taking your pills? You're supposed to start taking your pills within 5 days after your menses. Now, or when you're very certain that you're not pregnant, because when you're pregnant, you're taking the pills is actually useless as that time. And now, how do you take it? Some people take oral contraceptive pills only when they have sex. This is actually a very wrong way of taking it. If you take it only when you have sex, you will get pregnant. So you take it every day, not only when you have sex. In order to keep track of your oral contraceptive pills, that is, so that you're not forget taking them, it will be good for you to mark a particular time of the day. Let's say 8 a.m. in the morning when you wake up, you take your oral contraceptive pills. So you have it at the back of your mind that 8 a.m. every day you take your oral contraceptive pills. Or you can set an alarm. If your alarm rings at any particular point in time, you know okay, you're supposed to take your oral contraceptive pills. Or in modern times, most people now they decide to use apps in order to keep track of when they're supposed to take their oral contraceptive pills. Whichever will work for you is perfect. But the most important thing is you should not forget to take your oral contraceptive pills in order not to get pregnant. When you start taking your oral contraceptive pills and you miss one or two pills, you can take the one for the previous day and take today's own as soon as you remember. Now you should know that it is okay if you take more than one pill in a day or take 2 pills at the same time. You shouldn't go back and take a pill from the day before yesterday. That is not alright. Now in week two, if you miss 3 or more pills, you should go back and take the one for yesterday and today's one, and then you continue taking your pills one per day as you're supposed to be taking it. But you should know that at time missing all these pills, you're at risk of getting pregnant. So what do you do? During this period, I miss these 3 pills. It is good for you to either abstain from sex or use protection such as condom in order to prevent pregnancy. So that's the best way. For week three, if you miss 3 or more pills, you should go back and take the previous day's one, take today's one, and then continue taking your pills one per day. But the difference now is this: for the week three, you are going to skip those 7 days drug that does not contain hormone, and you are going to start a new pack. So you're not going to take those last 7 days drug. And if you're using the 21 days on tablet, you don't need to skip, you don't need to give yourself a break before you start over. So after you finish the 21 days, you just start the pack all over again so that you not be at risk of pregnancy. But you should know that when you miss 3 or more pills, it is normal for you to see bleeding. So you should not be alarmed when you start seeing bleeding. The risk of pregnancy is greatly increased if you start a new pack 3 or more days late, or when you miss your three pills at the beginning or at the end of the pack. As you miss do these things, you are at risk of getting pregnant. Now, if you miss 3 or more pills and within the last 5 days you've had unprotected sex, it is good for you to have emergency contraceptives in your house. So you take the emergency contraceptive to prevent pregnancy. This means even as you are having the oral contraceptive pills with you or you're on it, you should also have emergency oral contraceptive just in case you miss your pills and you need to take it in order to prevent pregnancy. Thank you very much. Please, if you're not subscribed, please click the subscribe button and follow me. Thank you.